Adriane. Is that a big glass of vino I see?
No, it's cranberry juice because I'm trying to prevent a bladder infection.
Well, that's very smart of you, Adriane, because UTIs are no fun and they can be quite serious. So, as we get older, we are going to experience more UTIs. And some of the factors are for women, our estrogen has dropped, especially for postmenopausal. And for men, it's they often have an enlarged prostate as they age, as well as part of the aging process. Our immune system is also going to be weakened, and our pelvic muscles also are not as strong as they used to be.
Well, urinary tract infection is part of a bigger picture, but quite common is just an ordinary bladder infection. You know, 1 out of 2 people will get a bladder infection in their lifetime.
Wow. I honestly, I have to be honest and say that I have never had a bladder infection or a UTI, but I think you have had a bladder infection, haven't you?
Well, yes, I have, and it's not fun. Some of the symptoms that I experience is kind of a burning sensation in my urine as I try to pee. The other one is frequency, going more often. The smell, there's a little bit of smell associated with it, and the color. Sometimes it's a bit of a dark color.
And I guess if you're in doubt, go see a doctor and
Oh,
get it checked.
yeah, that's the first thing you should do. If you experience any of those symptoms, go see your doctor and they perform a simple urine test. They send your urine for a culture, and you'll know in a couple of hours whether you have a bladder infection or not. And then
Mhm.
the treatment is fairly simple.
So, is there anything that we can do to prevent UTIs?
Yeah, there's lots of things you can do to prevent UTIs, Marina. One of them is drink your water. Drink plenty of fluids, especially if you're in a tropic when it's hot out and you tend to sweat more, or if you're doing physical exercise and you exert yourself more. The other one is wiping. Always wipe from front to back, never the other way around. Of course, urinating after sex. Always do that. And then clean yourself afterwards, whether it's a wipe or a shower.
Well, I know that the drinking of the fluids is especially important because it helps flush the bacteria out of your body. And I mean, we're dealing with some nasty, nasty bacteria. Like E. coli is one of the ones that is responsible, along with other ones. The other thing, sadly, is as we age, a lot of people who come down with UTIs actually get them in the hospitals because they're incontinent, they're in bed and they're having to use bedpans, and also the use of catheters really just opens up that environment for that nasty bacteria to get in there, and people can get very, very ill. I mean, they can die from it if it's left untreated.
Yes, it can lead to sepsis. Sepsis can be life-threatening. Some of the symptoms to look for that is if you ever experience any kind of drop in your blood pressure, increased heart rate, shortness of breath, some body aches that you have, shiver, those chills that you get, or confusion, that's a sign of emergency. Kidney infections can be lethal because they can cause sepsis.
Yeah. And you can
Emergency.
And you can see how it can be a real problem with anybody who's suffering from dementia, or if you're a caregiver to somebody who has dementia,
Yeah.
because, confusion and a lot of people who have cognitive issues, they might be wearing Depends and they may not be able to verbalize how they're feeling. So it's so important to just monitor not just ourselves, but also if we're caregiving, to those around us as well.
That's a very good point, Marina, because they
Yeah.
can't tell us, especially some of the elderly. They can't verbalize. They don't know. They're just not feeling well. So it's important to ask questions if you're looking
Mhm.
after somebody like that.
And just be observant, right? Now,
Hmm.
the other thing that can lead to getting a urinary tract infection, I heard, had to do with your underwear, right?
Yes, Marina. What kind of underwear do you wear?
Sexy ones, of course.
Nah, no, 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 no. You need to wear breathable, preferably cotton.
No butt floss,
Nope, grandma. Think grandma underwear.
big bloomers.
Yeah. The other one you really have to be careful with is do not hold your urine.
Mm.
If you have to pee, you go right away.
I'm bad for that. I'll be at work and I don't know what it's almost like a contest, like a personal challenge. It's like I know I have to go pee and I'm like, "Well, I just gotta finish this paragraph, right? Or I'm just gonna finish photo editing this picture." And then all of a sudden it's like, "Oh my," and then I'm running. And by then it's, I have to stop doing that.
So Marina, the other thing I need to say is probiotics. Probiotics can really help to change the pH system. Um,
Mhm.
yeah. What else
It's
can I tell you? Vitamin C. And
good
don't
one.
forget our friend, the cranberry juice.
Now, I have to confess, the only way I like my cranberry is with vodka.
Of course you would. But there is an extract that you can get, so you can take that if you like. Marina, I need to also ask you now, have you done any research on men? Because I know all the ones I know, females got the urinary tract infections.
Yeah,
What about
actually,
men?
actually a lot worse for men. It's for penile UTIs, and I like to think it's just because their junk is a little smaller. We have a little bit more room to work with. But what happens is they often become what they considered complicated UTIs, and they will require a longer and a more intensive treatment of antibiotics, and
Well,
sometimes several different types of antibiotics. It's actually quite bad for men.
yeah. Well, that is the treatment for a bladder infection and urinary tract infection. For bladder infection, it can be simple 3 to 5 days of antibiotics, but for urinary tract infection, which can lead to a wider area, that requires more antibiotics, right? So it's important to get it treated early.
I know so many people who have problems with UTIs, and especially reoccurring ones, and they have been struggling with them for a number of years. Now, I know that one of my friends in particular has a real hard time every time she travels and goes anywhere tropical. Would you
Yep.
have any idea why that would be?
Because it's the heat, right? The heat dehydrates. And that's why you need to intake more water, and cranberry juice is your friend.
Oh, this is true, but also I suspect that when my friend is traveling, she's probably vacationing, which would lead to alcohol and drinking cocktails, maybe more than we're used to. And also probably not wearing grandma underwear and maybe even having sex. Right.
Right. So, those are all tips. We need to take care of ourselves because sometimes it does go unnoticed. If you experience any kind of pain, if your urine changes color, if you're having problems urinating, you need to get that checked out. Will not go away on its own.
So I will try to maintain a healthy urinary tract. That will be my goal this week. I will not hold my urine when I have to pee. I will wear the ugliest underwear I can find in my drawer, preferably with a few rips for extra ventilation. I will drink copious amounts of water. I will take probiotics, vitamin C, and cranberry extract, and I will be on my road to a happy, healthy urinary tract. What do you think of that?
Couldn't said it better myself, and that is part of aging well.
So, if you have a story about UTIs, bladder infections, what happened to you, how you dealt with them, any tips, we always love hearing from you. And actually, the suggestion for doing this episode on UTIs did come from one of our listeners. So, thank you for sharing that idea. We love it when you talk to us.
Send us more. Till next time,
Bottoms up.
cheers.
Get it? Bottoms up.